Okay. So I work on the inpatient side. The way our inpatient team is set up is we've like split it between school agers. So we do school agers, toddlers, preschoolers, infants. So we do 0 to 9 and then 10 to like 18. And then we have a separate PICU specialist. And so I see all of our pediatric patients. And even though it's inpatient, I like kind of have a similar routine every day of like reading report, checking in with nurses. It still looks very different day to day, depending on needs. I would say
kind of cutting out a little, Katie.
Oh,
Sorry.
no, thank you. Is this better? Maybe it was my, okay. So day to day looks very different, kind of just depending on what the needs are. We'll do a lot of like procedural things as well, like IVs, blood draws, preparing for different tests, surgeries, things like that. But then there's also the component of therapeutic interventions, helping them adjust to like maybe a longer hospitalization stay, coping with like new diagnoses and how they're adjusting to all of those things as well, in addition to also doing department tasks like cleaning toys and facilitating programs, which has also been interesting during COVID and finding different ways to adjust that. So it looks very different, but the days sometimes go by pretty fast.
I was just going to say too, I've worked now since I was inpatient at my last job and now I'm outpatient. And I didn't really understand totally know the difference between the different workflow for inpatient for outpatient for child life until I took on a different role, obviously. But the programming piece, like Katie was saying, like it takes up a lot. It's a lot of it can be a lot of your day. And like helping, when we have programming like Open Heart Magic as a group, like making sure that you have a list for them, like helping coordinate with them, like the volunteers, you normally manage the volunteers, right, Katie?
Yeah, we do.
There's a lot of other department tasks, like she was saying, that you don't always know about, even when you're an intern, because usually your mentor or supervisor is kind of doing those so that you can get all the clinical experience work. I think that was something I didn't think about as much as internship, which I wish I kind of had thought about a little bit more when I was thinking about where I'd like to work. There's just a little bit, like I don't have to do any programming in the ER because the kids aren't staying for that long. So there's some of that piece that's more specific to inpatient, I think, which some people love doing. So it's, again, you kind of find your niche of what you like and stuff. So.
I'll jump in. My day-to-day is very different from what you just heard. Again, I work for the association now, so it is a desk job at a computer. Before COVID in the office for the last year, I've been working from home. On any given day, I can have probably 2 to 3 calls with various ACLP committees, volunteers, members, on any number of things. Some of our committees have been doing work around emotional safety, the Emotional Safety Initiative, to help the general public better understand the importance of looking at the emotional needs of children in healthcare, that it's as important as patient safety and that we have to prioritize it the same way we prioritize patient safety. Other committees are looking at things like data and benchmarking and how many patients child life programs are seeing, all of these big projects that we work collectively with our members on to help drive the field forward. I spend a lot of my time on Zoom, and it's a very different kind of role. I think when I first came to it, it was a big adjustment because I was used to, just that direct work with children and families, which I don't have anymore. But also I was in jobs where I never sat down before. And so adjusting to this role it's had its challenges, but I really love that the work I do now helps support child life specialists in the work that they do. So it's, when I think about the ripple effect, it's not just whatever patients that I could touch in a day anymore. It's 5,500 certified child life specialists that I get to in various ways support and provide resources for and provide connection opportunities for. I find that very fulfilling. And I've come to really love some of the big picture things about child life, about making sure we're part of the big conversations that are happening in the world. Like right now with the pediatric vaccine trials, we've put out statements that at a minimum, child life specialists should be consulted in setting up pediatric vaccine clinics, because like we have an opportunity here to make sure that this doesn't become a traumatic experience for an entire generation of children. And especially with, I don't know what vaccine rollout has been like in some of your communities, but here it's been a lot in community centers and schools, places children and families are going to need to go back to. We cannot turn these into potential trauma locations. So that's something that we've been working on, putting together education for parents with tips from child life specialists on how they can support their children through that process. So all kinds of different things. It's still never the same day twice, which I actually find very similar to when I was working clinically. But it's I guess a couple steps removed from that direct work with children and families.
Thank you. Kind of to shift gears back to internship, but reviewing the questions, what do you guys feel like? I'm sure many of you have sat on interview panels for interns. What do you think makes a strong internship candidate? Other questions that we were getting to were, are internships paid, or what kind of financial support is offered, or what other creative ways can students kind of approach that as well?
So I'll let the others that are hospital-based talk more about what stands out for applicants. But as far as, the paid piece and financial support piece, in general, internships are not paid. I'm not aware of any right now that are. There are some financial supports available through ACLP. We offer our diversity scholarship program. We've been very lucky to have grant funding for that, stable for several years, and I have every reason to believe that grant will continue. There are also some hospitals that, through whatever combination of program dollars or philanthropy dollars, have the ability to offer some scholarships and stipends. That's a fairly new development, but I've seen a growing number of programs that are able to do that now. But I wouldn't go into it with that assumption. So I think, knowing that this is going to be part of the path, anything you can do early to plan ahead for that is important. I think also applying places that you reasonably can go. If you know that for whatever reason, financial circumstances, family circumstances, just it's not what you want, that you can't move across the country for an internship, save yourself some time. I think it's important to be realistic about what's a good fit for you, not just trying to get an internship. It's a two-way street. It has to be a good fit for the program. It has to be a good fit for you, something that you can realistically do and not make things too much at such an early career stage.
Katie, I'll let you maybe talk a little bit about, you're on internship committee, right?
I am not, but I've sat in on interviews before. I've been in the office and they talked about a little bit of what they're doing.
I was just going to say, from a perspective of something I think is super helpful, and that I think when I went through the interview process, a lot of questions were related to just ages and stages, and it sounds really simple, but even just the knowledge of being able to pick out a developmentally appropriate toy for a patient, you learn that obviously in your classes, but also just putting it into action, and then also through volunteer work, you pick up a lot of that. But I think that's a basic thing that really stands out, is if the candidate knows what a developmentally appropriate, those stages and stuff, and maybe even a theorist that supports a child development theory, because I still don't think I fully grasped how important that knowledge was until I was in my master's program. and really like putting it more into use with like in my clinical work and experience at Erickson. And it really is just like the basis for everything you do, whether you're just dropping toys off to a patient, whether you're deciding on how you're going to prep the patient for surgery, whether you're deciding how you're going to do distraction during a procedure, or figure out how they're going to do pill swallowing or anything like that. It's really just like that basis of how you're going to build off everything you do clinically. So I think that is just such an important skill and something to really hone in on your knowledge of that when you're having internship interviews.
Kind of going off what you were saying, I also feel like, at least when I was going through the interview process, you're like supposed to go to your internship to like kind of learn more about child life and like how you're going to like implement things and all that. So in showing like your knowledge about child development, and I always like when people like pull in stories and show how they've actually like applied it in life versus like just rattling off like Erickson stages, like thinking about different situations where you've been in, where like you've applied it and how it's like turned out. Because I think that shows like kind of like true understanding of everything. No, I don't think anybody when they're interviewing expects you to like be able to walk in day one and like know how to like appropriately like prep a kid for an IV. That takes you like observe for like many weeks before you're the one like solo, like going solo into the room. So I would say like not to like think about that all the time, but more so like the basics that underline kind of what child life is and dealing with difficult situations and kids. So that is what I would say is like a big thing that I think we look for. Also, just at my personal experience with going through the internship process too, you like as you're interviewing, like you might have a feeling that you'll click better with one site than another. And it might not be that a site doesn't like think you're qualified enough. It just might be that your personalities for who you're going to be lined up with might not be the best like fit during that rotation too. So that's also like something to consider. Like you're also interviewing the site and see if you want to be there with them, taking everything in, because you'll spend a lot of time together.
Yeah. And to bounce off that too, like even if you like really, really want that program, but then the internship, like the interview just doesn't feel right, like you're going to be spending so much time there and you're not going to learn the best way. Like I interviewed at a lot of the Chicago children's ones, and I worked at 2 hospitals. Like the vibes at different hospitals are just very different. And like some people are better suited at some place, like depending on how they structure programs. Like every child life department is so different. So just really like you really need to make sure you feel like you're happy with that program too. Because it's going to impact, I feel like, your experience as an intern.
I think too, kind of going off of that, if I could, I remember when, it's been a while, but I think this kind of still stands the same. A big thing I didn't realize until I was kind of on the inside of the process looking out with like my supervisors is how you walk in, how you're dressed, and how you present yourself. It seems like kind of a silly, small thing, especially with Zoom and phone interviews and things like that. But I do know there was a situation once when there was a perfect candidate that met all the criteria. And my supervisor said, yeah, but her skirt was just a little bit too short. And I didn't think her attire was going to match the philosophy of our hospital. So that I don't know where the things stand with that kind of thing now, but I just always kept that in the back of my head as much as I'm working on all of the fundamentals of child life and everything, just to remember they're also wanting to present yourself in a professional manner too.